This is the time of year many people are getting ready to pick their employee health care plans. It's an important choice that could help you save a lot of money. And choosing the right plan is even more significant this time because health care costs are expected to go up as much as 8% next year. Joining us with some advice on how to make the right decision, Kelli Grant, senior consumer reporter for smartmoney.com. Kelli, good morning to you.
Good morning.
Boy, it is easy for this to all go over your head when you start talking about this. Premiums and deductibles, premiums, the monthly payment, deductibles, the amount that you pay before the health insurance kicks in. You really need to pay attention to this time.
You do, and I mean, we hear from a lot of the professionals that they say that people spend more time picking a microwave oven than they do their benefit plans, and this is really not the year to do this. As you mentioned, healthcare costs expected to go way up, but we are seeing a lot more choice among employer plans. A lot of them are offering what they call consumer-driven health plans, and these are actually going to lower premiums, but there's a higher deductible. So for consumers, it really comes down to you have to do the math and figure out where you're going to spend the most money based on some of your previous healthcare costs.
And actually look at the plan this time around, compare the costs, and it should be easier this time.
It should be easier, and that's a very nice thing for people. The Affordable Care Act requires that insurance providers use a standardized form to describe the premiums you pay, the benefits, all of those little details. So it should be very easy for families to compare one spouse's plans with their partner's plan and really get a sense of where you're going to find that best option and go with it.
There is a way to save potentially on co-pays and prescription costs, something to think about in 2013.
Flexible spending account. That's the key word there. This is something that we talk about pretty much every year is a great way to save on all of those out-of-pocket costs in the coming year, and usually you have to sign up for it when you're making that open enrollment choice. The key for next year is, unfortunately, the government has actually set a limit on it, so you can only put aside $2,500 in pre-tax dollars, but it's still pretty substantial savings, and believe me, we hear it, you can go through that money pretty quickly.
Get Healthy, or the Pledge to Get Healthy, you'd be amazed that can actually save you some cash.
You can actually save a lot more money now than in previous years. We've always been talking about that employers like it when their employees are healthy, and they'll offer some sort of a discount or cash if you do things like go for a healthcare screening, even like learn how to cook healthy, quit smoking, lose weight. But now that healthcare costs are really on the rise, then employers are actually upping those incentives. In some cases, we've seen as much as $1,000 back for what can be, on your part, maybe just a half an hour or so of work.
Keeping an eye on the deadlines. I think a lot of us assume that just because the plan rolled over into this year, it's going to happen again next year. That's not necessarily the case.
Very bad assumption to make, particularly this year. We do see that a lot of employers are actually cutting down the amount of time that you might have to make an open enrollment decision. In some cases, it could be maybe as little as 2 weeks rather than a month on some of the more generous sides. And in a lot of cases, it doesn't just do to assume that whatever I picked last year is just going to roll over into next year. In some cases, you do have to make an active decision, pick a plan, and go with it. Otherwise, you could find yourself not covered.
The devil is in the details.
It is.
There it is.
Definitely look at that.
Kelli Grant, senior consumer reporter for smartmoney.com. Kelli, thank you so much.
Thank you.